What is the primary source of oxygenated blood supply to the lung parenchyma and supporting tissues like bronchi and pleura? Which artery typically provides the right bronchial artery, often arising indirectly from the descending thoracic aorta? Bronchial veins primarily drain into which structure, contributing to potential mixing of oxygenated and deoxygenated blood? In the dual blood supply of the lungs, what distinguishes pulmonary arteries from bronchial arteries? Damage to the posterior wall of the right main bronchus during bronchoscopy is likely to injure which adjacent vessel? The pulmonary plexus, responsible for airway smooth muscle tone and bronchial secretions, forms from branches of which nerves? Sensory fibers innervating the lungs primarily originate from which vagal ganglia? Sympathetic innervation to the lungs mainly targets which structures? During which embryonic week does the laryngotracheal groove first form on the floor of the foregut? In lung development, type 2 alveolar cells begin secreting surfactant during which stage? The pseudoglandular stage of lung development, week 5 to 17, primarily features what key process? What marks the transition in the saccular stage, week 24 to 40, enabling potential viability in preterm infants? Premature infants often suffer respiratory distress due to insufficient surfactant from type 2 cells, which fully mature in which trimester? In ARDS, chest X-ray typically shows what finding due to alveolar capillary damage and fluid leakage? Sepsis is the most common cause of ARDS because inflammatory cells damage what structure? A congenital diaphragmatic hernia results from failure of what structure to close around week 6? Tracheoesophageal fistula often arises from abnormal development in which stage? In chronic bronchitis, a COPD correlate, what histological feature correlates with mucus hypersecretion? Positive end expiratory pressure, PEEP, in mechanical ventilation for ARDS risks what complication indicated by hypotension? Aspiration of a foreign body in a child is most likely to lodge in which segmental bronchus due to anatomical branching.